feel run down? Have a hard time keeping your focus? Have you lost your sense of humor? Many people feel this way and don't realize they have a medical condition called sleep apnea. Could this be you?
At first glance, life at the Hummel family home seems harmonious. But when the sun goes down,
everybody's going, what on earth is that?
John Hummel's snoring shakes the whole house, but noise is only part of the problem.
Not only is he not breathing, but he's trying to breathe. He's going, and nothing's going in. We're not allowed to open our windows when he sleeps because it is so loud that we have had neighbors call us and say, could you please close your windows? We can't sleep.
The only relief seems to come when John occasionally sleepwalks. At least then he isn't snoring.
He will get up and he will do laundry in his sleep. He'll take the whole bottle of Downy and just be pouring it in.
As a family, the Hummels try not to take the situation too seriously.
You know, when the kids are telling their friends, if you spend the night and you hear the bear, don't worry about it, it's just my dad.
But the reality is, even though John is unaware of his snoring, it's a serious matter.
Sometimes it's very difficult to describe to somebody that when I sleep, I get maybe 15 minutes of sleep for every hour that I sleep, and so I get tired by sleeping.
John confides to his doctor that he catnaps often in odd places, and he pounds coffee like there's no tomorrow.
Caffeinated cola, caffeinated drinks, caffeinated gum, caffeinated mints.
But even after surgeries to open his nasal cavity, it's all he can do to slog through each day.
I get so tired in the afternoon, it's really hard for me to do my job.
Brain fog, crankiness, depression. To neurologist Lydia Wytrzes, the signs point to sleep apnea, a condition that takes insomnia to a whole new level.
In most cases, it's a combination of genetics, what you've inherited, the shape of your mouth, or how much excess tissue you might have back there, further complicated by weight gain.
At the sleep lab at Sutter Medical Center, Sacramento, this test will confirm it.
These are kind of like Band-Aids after a little bit.
The team wires John with electrodes and shows him to a cozy room where he'll sleep for one night.
Good night.
Even with all the wires, John is so tired he drifts into peaceful slumber.
We look at brain waves to determine what stage of sleep you're in or whether you're awake or asleep. And the eye movements help us determine what stage of sleep you're in, as well as the chin.
And in my case, I was arching my back and my ribs were expanding. I was trying desperate to gasp for air, but my throat was closed.
When most people realize how little sleep they get, they're frankly shocked. Over the course of the night, patients may awaken hundreds of times.
Here, many patients learn sleep problems put them at risk for other serious health issues.
Sleep apnea has been associated with high blood pressure, with heart disease, including heart attacks, irregular heart rates, strokes.
My oxygen was dropping below 50%, which was lethal. And in my particular case, it would actually cause my heart to slow down or speed up, or I'd have high blood pressure.
For most sleep apnea patients, a nighttime breathing device called a CPAP helps.
It works, it's not painful, patients get a lot out of it, and immediate relief.
In some cases, doctors also turn to medications, mouth appliances, or surgery.
They take the little dangly out of the back of your throat and they do a little facelift on the back of your throat.
But John's apnea is so persistent, he requires a trach, a small device inserted into a hole in the throat that allows him to breathe at night.
It completely changed my life.
Treatment for sleep apnea can be a miracle. They have energy again. They're productive at work. They're not getting in trouble anymore by falling asleep on the job.
Now John's taking advice that Dr. Wytrzes shares with all her patients. Go for the routine. Schedule regular rise and bedtimes. Drink water to hydrate your body in the morning, not at night. Nix the late-day lattes so your body can gear down. Lose weight and exercise.
Strategically placed exercise in the late afternoon or early evening is very helpful towards getting a better night's sleep, but it's regular exercise. It's not just that big hike on the weekend.
And I think the one thing that I keep telling everybody that I run into, as soon as they tell me they're snoring, is get yourself to a sleep doctor.
You have to get the treatment because it's not just one person it affects. It affects a lot of people. And it affects the whole family, and they'll all be celebrating.
What you find is as you start to attack these problems is that you get a better outlook in life. You find your family appreciates you a lot more rather than being Mr. Grumpy all the time.